Hi guys, good morning. This is Kimmerman from Kimmerman Studio, and in this video I will show you what are the standard item included in the emergency response bag, particularly what we are using here in Johns Hopkins Aramco Healthcare Clinics, remote area clinics. So this video actually is intended for those who are working in MMSR clinics or the minimum medical service requirement clinics where I worked also before, because I know we don't have standard items, or per clinic we have a variety of items included inside our bag. So as per JHAH or Johns Hopkins, these are the standard items that should be or must be inside your bags. So I'll just show you quickly on what are included in the bag. So it's pocket 1. These items, or this label like pocket 1, 2, 3, 4, 5, these are the outer pouches or outer compartments of your emergency response bag. I'll show you later, but we label it as pocket. So pocket 1, there should be BP cuff, stethoscope, paramedic shears. Pocket 2, ace bandages, gauze squares, triangular bandage. Pocket 3, your abdominal pack, trauma pack. Pocket 4, yellow hazard materials bag, general waste bags, waxed paper bag, and sharps container, small sharps container. Pocket 5, your pair of goggles, disposable gloves, aprons, forms, usually forms, transport forms, release from liability, black pen, disaster tags. Actually this will vary per company, but in JHAH and Johns Hopkins we are using specific forms for this. We have standard forms to use. Inside the bag, when you open it, there is this one, the support side area, so meaning in the edges of the bag you should have padded short arm board, long arm board, wire splint, and Yanker suction handle. Pouch 1, or inside the bag, there are pouches. You can see, or you should have these things: adhesive dressing, tender sat, micropore, zinc tape. Page 2. Okay, you should have this iodine solution, instant ice pack, and bacitracin ointment or fusidic ointments. IV compartments, there are 3 IV compartments, so we just label it 1 and 3. You should have these things inside: examination gloves, normal saline 1 liter, giving set or your IV tubes, tourniquet, swabs, cannulas, tegaderm, mostly for IV fluid insertion. Central compartment, or the IV pouch number 4, actually it's the same, but the difference is the solution, the lactate ringer solution. So this one, pouch 3 and 4, so don't get confused, these are compartment. There are 3 compartments. Again, inside there are pouches again. So pouch 3 and 5, you should have this for airway adjuncts or apparatus, like breather mask, nebulizer set, cannula, nasal cannula, standard mask, and suction cannula. Pouch number 4 should have this also: ambi bag, CO2 adapter, airways. So these are the sizes: tongue depressor, syringe, bandage, disposable water soluble gel dispenser. And in the yellow compartment where the medication must be placed, these are our standard medicines or emergency medicines inside. So Miodarone, you should have this. By the way, the number here, these are the amount. Again, don't be confused. These are the standard quantity of all the items. We follow this so the bag will not bulge out or not be heavy, too much heavy like that. So you should have this quantity of this item. I forgot to explain. Again, back to the medicine compartment or the yellow medication compartment. You should have this, like 3 amiodarone, 3 epinephrine, 1 is to 1,000, and 2 Abujex of epinephrine, 1 is to 10,000. This is the ideal, what we are following here. So insulin, alcohol, syringe, needles, aspirin, nitroglycerin, and this one, hypoglycemia kit, or your candies or juice. Cervical collar, this is just inserted in the handle, bag handle, and of course security seal number. Then put your sign and date on when did you check it. Usually we check this every Friday. Also, you can see here the expiration date. So we are strictly complying on this thing because this item should be discarded within the 3-month near expiry period, and the item should be updated always. The expiry date should not be within 3 months near expiry period. So I hope this MMSR clinic will have a guide on what to put inside their emergency response bag. This is Kimmerman from Kimmerman Studio saying goodbye, God bless, and happy working in remote area clinics. This is what a emergency response bag looks like. So again, this is what I'm talking about a while ago, the pockets or the compartments. So these are the pocket 1, pocket 2, 3, 4, and 5. And I will not open this bag because I have a video for this where I specifically describe all the items inside. Then this is your C-collar. See, as you observe, the bag is not bulging or heavy if you carry it, because we follow only specific quantity of this bag. So this bag can accommodate 2 patients, and for extra patients we have this disaster box here. This one is the disaster box, which can accommodate 3 patients. So this one and the emergency response bag can accommodate 5 patients during disaster. For bonus video, I opened the bag already so you can see what's inside. These are the medication, the pouch 1, pouch 2, pouch 3, 4, 5, and the IV compartments. Yeah. For this detailed review, watch my video on this thing, the Thomas Pack emergency response bag. It's here on the YouTube. Thank you.